stakes couldn't be higher. This is about saving lives.
We are not able to test all NHS and care staff at the moment. But what we are seeing is increasingly more patients coming in who are COVID-19 positive, coming in their 30s and 40s, who were previously fit and well without any underlying health conditions. Yes, I mean, it really does. And we were hearing so often that it only really affects people over 70. It only really affects people that have underlying health conditions. Because what we were seeing echoed on the NHS frontline was the fact that people were coming in who were young, fit and healthy. Of course, the majority of the patients will be older, those that actually require ventilation, but no single group of people are immune.
Science advice is actually absolutely rock solid worldwide that the best way out of this is to keep people apart from each other.
All the evidence points that we may be in this situation for many months to come.
The most important thing in all of this is protecting human life.
Politicians are having access to testing when frontline NHS staff who are going in to work night shifts, day shifts, double shifts at the moment. I'm really disappointed. These are the people who are at the front line. These are people who need to know whether or not they have the virus or not. Let's roll out mass testing so that we know what we're working with. It worked in South Korea. It's done well in Germany. Let's roll out mass testing. Let us really understand what we're working with. And then if people also observe the social distancing measures, we can save lives. So proud of being is a part of the NHS family. And about 1 hour ago, I left the most incredible team of people. I know that we have the resilience to cope with this. We are strong and we will do whatever it takes to save every single life.
The government has insisted throughout the coronavirus crisis that it's been guided by the science. We've seen the experts standing alongside the Prime Minister at those daily press conferences.
The reality is that we need to be sure that a vaccine is effective and doesn't have side effects or serious side effects. And so it will take probably a year to 18 months. The other thing we need to understand is more about the protective immune response to coronavirus.
Way out of the lockdown, if you like, is actually through mass testing. Nearly everyone, he said, could be tested.
Well, I mean, the science advice is actually absolutely rock solid worldwide that the best way out of this is to keep people apart from each other, which is why the advice of stay at home is so critically important, that you need to reduce the number of people that one infected person infects on average, which is about 3 for this virus, we think. And the only way you do that is by separating people. Now, it is also absolutely the case that we need to be able to test people who are working in the front line for whether they have virus infection. And if we're really going to understand and be able to model the epidemic properly, we need to know what fraction of the population has been infected. The disease emerged in Wuhan, and they've clamped down very hard. And I think everyone around the world who understands the epidemiology is looking to see whether the outbreak does start again. But I mean, also, I think in the next phase, it will be really important at a time when we have much better and more abundant testing to do that testing whenever an outbreak seems to flare up again.
Do NHS workers have the protective equipment that they need?
Well, in the last few days in my hospital, they have started to receive the personal protective equipment. And I know that we are very grateful for that, because it does make us feel safe when we go to work if we know that we can protect ourselves. But what we really are concerned about on the front line, and I'm hearing this from my colleagues around the country, is the fact that we have some very senior politicians who are saying that they will return to work after 7 days without knowing how long their symptoms will last. And what we are so concerned about as health professionals, and something I'm deeply concerned about, is that the advice that we are giving is actually not in keeping with what the World Health Organization are saying. They are saying that you can still be able to spread the virus long after your symptoms have resolved. And they are actually saying that it is recommended that you stay self-isolated for 14 days. Some people, they have the disease process that lasts for 12 to 14 days. So for senior politicians such as the Prime Minister and the Health Secretary to suggest that they will return to work after 7 days is a real worry for people working in the health sector. Personally, I believe that the government needs to change their advice to be in keeping with what we're seeing around the rest of the world and what is in keeping with what the World Health Organization has said. They have said that long after symptoms resolve, one can still be infectious. Now, if we're doing our very best to save lives, to make sure that no unnecessary life is lost, we have to ensure that we are sticking to guidelines that make us able to save lives and for the virus not to be spread. So I would like Boris Johnson, the Prime Minister, to self-isolate for 14 days. Yes, I would.
We've heard reports, every single MP across the country will have had reports about workers who are frightened because they know that their colleagues have gone home sick with the suspected coronavirus. We know that people's lives are being put at significant risk, and that places further pressure on the NHS. Now, there are workers where their health is being put at significant risk, stated that if you can't work from home, essentially you should go to work. And they have stated that indeed it's important for business to carry on. And the government needs to now be very clear about what non-essential and essential work is and make sure that those workers are at home if they're not providing an essential function and that they're financially protected. The most important thing in all of this is protecting human life. And every single decision that's made economically has to be centred around that. But at this time, the government's main priority should be ensuring that people are able to stay in their homes and that they're financially protected enough to do that. It also highlights the fragility of all of our lives, no matter what our job is, whatever our income is. We're one paycheck away from destitution in many cases. And it's also highlighted the dramatic underfunding of our NHS and public services to an extent that we weren't capable of being able to deal with the crisis